Surgical
cell wall.
pathology means anatomy sites. Cytopathology is like studies of cells.
Surgical pathology means?
By using tissue, they are going to do, ma'am.
Okay. So cytopathology is like study of
Yeah.
like the cellular level. Study on the cells that we say cellular level. Okay, for anything related to cluster of cells or fluids. Like for example, if you take pap smear. Okay, pap smear is for to screen the cervical cancer. Okay, pap smear is only for the female patient. And what do they do? They will take the brush biopsy. I mean, they'll collect the sample and like the cells, and then they'll do the cytopathology section. And also FNA, fine needle aspiration. Here also they'll take the cells only. Okay, these are common example for cytopathology. Surgical pathology means it will be like more of a complicated procedure where the physician will be having more work, and also it is an examination of tissue specimen. Okay, it can be organ tissue, okay, or anything like polyp. There are many you will able to see now. So it is more of tissue, not the cell. Okay, that is surgical pathology. And here in surgical pathology, the two techniques already you are all familiar with. One is gross examination, another one is microscopic examination. Okay, so as you know, gross examination means it is visual in what to say, inspection of the specimen. Okay, just through optical observation. When we say microscopic examination, they will do the staining and then they will visualize through microscope. That is utilizing microscope. So that depends on the severity or complexity of the particular procedure. So under surgical pathology, this is important concept. So this concept says, the code range between 88300 to 88309. Okay, so we'll explain. So you can see surgical pathology is an examination of tissue specimen removed during the surgery or biopsy to diagnose the disease or condition. So here, as you can see, it can be tumor or it could be biopsy, skin biopsy, prostate biopsy, okay, liver biopsy. In that, they may take needle liver biopsy or wedge biopsy. Okay, there are different techniques to it. And then whole organ, like they're taking kidney, they're taking complete kidney, or they're shifting complete uterus, appendix, gallbladder. Okay, all of this complete whole organ comes under surgical pathology. So as you can see, the techniques we have is, one is gross examination, visual inspection of the specimen, and then microscopic examination is looking at the stained tissue and the slice under the microscope. So now next, coming to surgical pathology CPT code range. So here we have the classification of surgical levels. Okay, so you have to first check the specimen and you have to go and check this particular specimen belongs to which surgical level. Okay, so you will be able to get your appropriate surgical CPT level. So you can check here. There are codes from 88300 to 88309, and it says 300. This is a very minimal procedure where they will do only cross examination, and 88302, it is include gross and microscopic examination. 88304, it is low level complexity. 88305, moderate level complexity. 88307, high level complexity. And 88309, here it is highest level of complexity. Okay, so it defines the physician work and it defines the patient problem, like the patient medical condition severity. Okay, with each specimen procedure and the procedure modality, you have to check, and particular specimen belongs to which level you need to take. Okay, then you may get the right level code. So before that, you can also see one coding guideline here. Okay, first I'll show the codes. See codes. So it is starting from 88300, which says level 1 surgical pathology, gross and only gross examination only. So if any specimen under surgical pathology, if they are only visualizing through optical observation, then you have to give your answer as 88300. Next, 88302, here it is surgical pathology, gross and microscopic examination. Under this particular level, they have listed few specimen. Okay, so you can see the specimen like appendix incidental, fallopian tube for sterilization, finger toes amputation traumatic, for skin newborn, hernia sac any location, hydrocele sac nerve, skin plastic repair, and then testes, vaginal mucosa, vas defect. So all of these are the specimen. So if you get a scenario where they are taking out appendix which is incidental, okay, you already learned about appendix in the digestive concept. So there I have mentioned that what is incidental appendectomy. Incidental, it was planned.
Without plan, ma'am. Without plan. Unplanned.
It is unplanned procedure. Okay, so likewise you have to check the specimen. So for that you should also cross verify whether the same specimen is present in any other level or not. Okay, so if you take an example 88304, here it is level 3. It says surgical pathology and gross and microscopic examination. Here the specimens you can see here: abortion induced, abscess, aneurysm, anus, appendix other than incidental. Okay, so you have the specimen appendix here also. Under 88304 also you have appendix as a specimen, and under 88302 also you have the appendix specimen. So now what you have to check? You have to check the procedure modality, like what they were doing, whether this appendix was incidental or planned procedure. If you get a planned appendectomy removal, then which code you should give?
88304.
Other
88304 you should give. Okay, 88304 will be your answer. Same way, there are few repeated, like the specimen, which are repeated in many other levels. Okay, with a slight difference in the procedure variations. Okay, so like incidental here, as we know, the physician work will be little less because he is already getting paid for the major abdominal surgery, and with that he is performing appendectomy. Okay, so same incision site, he will be performing that. There will be a little work less. So you will be assigning 88302 level. But when he is performing planned, then we have to go with 88304. Okay, same way you can also check like another example I'll give you, skin. Okay, so you can take an example of skin. The skin here, plastic repair. Okay, skin plastic repair, which is present under 88302. Assume you got once again skin as a specimen. You should look out the skin specimen present in any other level. Okay, so just see under 88304. Again, skin is present, but it is for skin cyst, skin tag, skin debridement. Okay, these are the three procedure. When you get skin cyst, skin tag, then what you have to give? Which level? You have to give 88304. Okay, same way, check under 88305. So here you have abortion, spontaneous, missed, and it goes on. And again, there will be again you have the skin under 88305. Okay, so it says skin other than cyst, other than tag, other than debridement, other than plastic repair. So if you get a skin something other than all of this, then you should give 88305 as your level. Okay, so if you want to know example, skin ulcer. Okay, ulcer formation is there, skin ulcer. So skin ulcer is present here in any of the level? No.
No.
Okay, it is not there. So if you get skin ulcer, then which level you have to give?
88305.
88305. Okay, and then check for another thing also. Okay, you can see 88307 and 88309. Both are, one is high level, one is highest level. 307 is high level, 309 is highest level. Here also you will get the repeated specimen. Okay, so take an example of breast mastectomy. Here it says partial or simple. Okay, breast mastectomy, partial or simple procedure listed in 88, listed under 88307. Next, coming down to 88309, here also you will be able to see the breast as a specimen. But what is the procedure variation here? Breast mastectomy with regional lymph nodes removal. Okay, so in 88307, they were doing partial or simple mastectomy. But when we see 88309, here performing breast mastectomy along with the regional lymph node removal. Okay, so then you have to give 88309 as your answer. Okay, so check for the specimen. First thing is you have to check for the specimen, and again you have to look that particular specimen present in any other levels. If it is present, check for the procedure variations. Okay, then only you should able to get the proper CPT, surgical CPT level. Okay, so one more example I'll show you. So here it was under 88305, abortion, spontaneous or missed. So they have the sample which is aborted through spontaneously or missed abortion. Then you have to give 88305 as your level. But in case if it was intentional abortion, if provider himself remove the the product of conception, then intentional
88304.
abortion induced 88304. Okay, likewise you have to check and you have to take. The other one more repeated specimen is uterus. Okay, check for uterus also. Okay, so see, here one uterus is there. Uterus with or without tubes and ovaries for prolapse. Okay, prolapse, the uterus being prolapsed, then they are doing the procedure, that is uterus for prolapse. So the level for prolapse, uterus for prolapse code is 88. Where is that? 88 uterus for prolapse. 88305 is uterus for prolapse. Okay, and then look under another level, check under 88307. 307 also you will be able to see uterus. Here it says
Other than
uterus with or without tubes, ovaries, other than neoplastic, other than prolapse. It is not for cancer or it is not even for prolapse. Okay, something other than that. Then you can give 88307 as your CPT code. Next, 88309, Under 88309, again, you can able to see uterus as a specimen, uterus with or without tubes and ovaries for neoplastic. Okay, neoplastic means what? It is cancerous.
Cancer.
Okay, so patient might be having uterus cancer. For that reason, they might be removing the uterus completely. So for neoplastic, why they are removing it? The concern is it is cancerous. Okay, then you have to give your level or CPT code as 88309.
309.
Okay, so these are the groupings or these are the levels you have. Each specimen is important. You have to check very carefully and easily you can give. Another coding guideline here we have, that is units. How to give units? So say for example, under same level, okay, you have the two specimen and which are present in the same level, then you have to give 88307
Units.
and each specimen equals to 1 unit. Okay, each specimen equals to 1 unit. So you should give, assume if you have a 2 specimen, then give 2 units.
2.
Okay,
Into
and
2.
also sometimes specimen will be same. Maybe it is bone only. Okay, but in the bone they might have two individual specimens. For individual test performance, they might have two individual specimens. That time also, as we have the guideline,
Into 2.
each specimen equals to 1 unit. You should go with giving unit 2 only. Okay, so this is one coding guideline. Next, along with this surgical procedure, if they perform anything related to decalcification. So what is decalcification? Decalcification. So what do?
Yeah.
They will remove the calcium. Okay. So once they remove the calcium, that particular bone, maybe you think bone, that bone will be, after removing the calcium, it will become soft. Okay, so the once it will become soft, it will be easy in order to see the. I'll explain those. So decalcification is the process of removing calcium deposits from hard tissues like bone or teeth, so they can be cut and examined under microscope during histopathology or surgical pathology. So here in this procedure, they might be doing in order to take the surgical pathology section. So if you get with any of this CPT, if you find decalcification is performed, then you should utilize this additional code 88311, okay, as an additional procedure. And same way, if you get special stain, you can see here special stain and group 1 microorganism, group 2 microorganism, all of these are present. These are all additional procedure. But up to here, it is very important and likely, it is like a mandatory questions. So I'll show you a few questions. So check and try to answer. So check these 2 questions and type your answer. Easy, just find out what is your specimen. Okay, and check that specimen present under which level and what is the procedure variations. Okay, easily you will be able to get the answer. So please take 1 or 2 minutes and try to give the answer. Okay. So the first question is, wedge liver biopsy specimen was sent to pathology lab. Technician prepared the slide and who had performed and interpreted. So code for pathology service. So here the specimen is wedge liver biopsy. Okay. So under which level or under which CPT you are seeing this?
Double 3.
Okay. So here is the liver biopsy. Liver biopsy, it can be a needle biopsy or wedge biopsy. In our question, they have mentioned wedge liver biopsy. So it is under 88307. So the first question answer is option C, 88307. The second question, three individual tissue specimen from the partial left breast mastectomy were submitted for a surgical pathology, and then after microscopic evaluation the reason for surgery was a lesion of the breast. Each specimen required an independent comprehensive examination and report and decalcification. Okay, so you have the decalcification also, and there are three individual partial breast mastectomy is the specimen. Okay, so under 38807 you have the breast mastectomy partial, and they have mentioned three individual. Okay, so you should give units 3, and then for decalcification you can use 888.
Double 3.
Correct. Okay, so answer is option A. So next we have, so same thing, I'll discuss one more, I think. Check for kidney biopsy. Check for kidney biopsy and type your answer. So kidney biopsy is 88305. So under 88305 you can check. You have the kidney biopsy. Okay, 305 is correct. And one more. So see this question also. See this and type your answer.